our In Focus discussion tonight. The pandemic is unfortunately making a comeback more than a year and a half since it began. And the daily cycle of new and changing information can be overwhelming. Each month, our 7 p.m. team provides a monthly COVID-19 discussion on what's happened since our last update. Tonight, we hear from the people on the front lines of the pandemic about what they're seeing. Kicking off our conversation first are Randall, a palliative care nurse practitioner for Intermountain Healthcare, and Newman, a hospice physician with NYC Zen Center. Thank you both so much, first of all, for what you do in our community, and thank you both for being here tonight.
Thank you for the opportunity.
Meg, I'd like to start with you. Tell me about the work that you do in the hospital and how that's changed before and after the pandemic.
Well, thank you. I work with a palliative team in an inpatient setting as a consult, and as COVID began evolving, palliative care had a role in addressing symptom management, supportive care, goals of care for most advanced and serious diseases. With COVID, it became very specific to the dynamics of surviving the virus, reviving and recovering, and even the hope of thriving and moving out of the hospital.
And what about you, Brett? You do home visits for hospice. How has that been like during the pandemic?
Oh, it's changed so much. I've done home visits. That's been my practice for the last 20 years. And, you know, the comfort of being a physician who can go out into the home and just sit on the living room floor or sit with people at their kitchen table has always been just a really nice way to...
It's so intimate.
Yes, so intimate. And everything literally changed overnight last March in 2020. And in the beginning, in order to keep everybody safe, we really had to begin to transition to new ways of connecting people and figuring out how to be intimate in new ways. And we were either wearing our personal protective equipment, so PPE, so that's, you know, a gown and gloves and a full face shield and a mask.
So you look like an astronaut walking in, basically.
Or we were limited to telehealth. And I was especially lucky because of working with an incredible team of hospice professionals. And in almost any setting, so I do home visits to the home, skilled nursing facility, and assisted living facility. In almost any setting, the nurses were allowed in, although that was tricky, even in assisted livings and nursing facilities, because those facilities were kind of on a lockdown and didn't want outside staff possibly bringing COVID in. But with our nurses present, they were able to hold the technology and then allow me to talk with families who were in another distant location to coordinate medications and help patients continue to be comfortable despite the pandemic. We've always had a tough job, and I think the pandemic has made a hard job much harder.
And we had to get creative in those telehealth ways with technology as well.
I just wanted to say the hospital experience was similar with how much we relied on families to be part of the hospital experience for the patient, and when that was suddenly gone, we saw the staff and the different ancillary support at the bedside have to really change how they interacted and to be that support person for the going through the difficult illness. And the technology, as you alluded to, and how to connect with people over technology while their loved one might be unresponsive on a breathing machine. So it was a real challenge, and to the people at bedside, it was the way that we had to keep families connected during their loved one's difficult time.
I want to talk about your specialty in end-of-life care. You've seen death in so many ways. You've seen bereavement in many forms. How are you thinking about that during the pandemic? And maybe Brett, we'll start with you for this question.
Sure. So I'm a board-certified family medicine physician and also board-certified in hospice and palliative medicine. So it's just been my passion throughout my entire career. And the hardest part is seeing the toll that the pandemic has taken on our caregivers. So whether that's family caregivers or the actual health professionals on the team, our chaplains, social workers, home health aides, nurses. And it really has been a crisis, I think, for them. So you asked a little bit about bereavement. In terms of bereavement, and Meg and I have really, we have a friendship as well. So we have really turned to each other throughout this time to keep on talking. And
peer support, basically.
Peer support. Yeah. Share our stories, share our struggles, share our tears, and hold each other up. The most challenging part for bereavement during the pandemic was when our teams were completely isolated. We had to do all of our team meetings by Zoom type meetings. So we were all in remote locations. We could not hug each other. We could not hold each other's tears. Now that we are immunized, and that is one of the most important things that we can do, both in terms of our community and also to bolster up our healthcare professionals so that they can keep doing this work. Now that we're immunized, we are able to be in the same location again as teams caring for patients, and we can hug each other finally and hold each other's suffering and sadness. And I think that there's really something valuable in being present with each other that was lost when we were isolated. And now that we're immunized and able to come back together, that's been really positive and hopeful. Yeah.
And I saw palliative care take a new role, invited by the ICUs, specifically the COVID units, to provide end-of-life care in that setting. And oftentimes it was digital. Later we were able to provide the powered air purifying respirator called a PAPR, the ones that made us look like Martians, but it would allow patients to have their family member at bedside for a few minutes, possibly before they were extubated and allowed to experience their dying time. In other cases, we witnessed families getting very creative and sending their links to be on giant Zoom calls and singing in almost a chorus-like to wish someone well as they leave this world. And I think that kind of reinforced what was needed for the staff to know that their important work was being witnessed by families and that their loved ones at the bed were not being left alone. So the hospital really needs the community to know that everyone is doing the best they can, and the thing that they can offer us is the support in getting vaccinated for themselves. And when they come to the hospital with some respect and kindness of the rules, masking and limiting visits only for the safety of all of us so that we can continue to do the work that we so passionately know is needed and agree that we want to be doing.
Well said. If you want to thank and be grateful to our frontline healthcare workers, mask up and get vaccinated. Thank you so much. We've been hearing from Megan and Brett. Thank you so much both for being here tonight. Unfortunately, we're out of time, but we're so thankful to what you do, and thank you for being here tonight.
Thank you, Rosie.
Thanks, Rosie.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on our August COVID-19 update. Another field seeing the impact up close and personal of the pandemic are nurses, with this next spike pushing a number of them to their breaking point. Up next is Susan Robel, Chief Nursing Officer for Intermountain Healthcare. Susan, thank you for what you do, and thank you for being here tonight.
My pleasure. Thank you.
I'd like to start our conversation out with talking about what a typical nursing staff was like pre-pandemic and what we're seeing now during the pandemic.
No, that's a great question. You know, our nurses had so many things they had to change during the pandemic. So they would come to work and they would know everyone they're working with. As the pandemic has come upon us and our cases have gone up so much, there were nurses floating in and out, so they didn't get to know their teams as well as they would like. Visitation was limited for the right reasons, because we want to keep everyone safe, as our first priority was always our caregivers and patients staying safe. So they had to connect with families, make sure that they had that connection for patients, and sometimes, you know, be their family if they needed someone to comfort them, which was always something they had to do and loved doing, but it just became what they did every day. Protective equipment to keep them safe. Taking on, you heard a little bit on the last session, PAPRs. They look like moon suits, you know, coming in and out of a room. you know, and it's warm in there, and then they come out and they have to take them on and put them off. You know, a lot of different routines. And as we were learning about COVID, that changed all the time. We had daily updates. Now when you come to work, you need to wear this protective, you know, a device. And so it was really just trying to keep up with all the evidence and the changes that had to occur in their daily routine that they had pretty well down pat prior to COVID.
Nurses were asked to do so much more in such a small amount of time.
Absolutely.
What is the state of our hospitals right now? Are you all reaching capacity or already on the brink of being overstaffed?
We have been over capacity. We have that situation now with beds. And, you know, beds are one thing for patients, but you need nurses and care providers to care for them. So we have both going on. The surge happened so quickly that we have shortages in the ability to staff the way we're used to staffing or want to staff. So quickly pivoting to get resources in as quickly as possible, and we're making headway, but of course not exactly, you know, where we need to be. So that's been a huge change for our staff. A lot of them are working extra time, and many nurses, because it's what they do, are seeing where there's issues within their own other sister units and with colleagues of theirs, and they're volunteering to go and help. So they're supporting, you know, staffing as well. And that's what our nurses do, and I'm so very proud of them.
We are proud of them too, and so grateful to them. We've been hearing stories about a number of nurses who have been quitting because they're exhausted, they're tired, they're on the brink. Have you been seeing any of this at Intermountain?
We've seen nurses, you know, move to other units, you know, asked to change their hours. Many have contemplated leaving nursing. Across the country, this is happening. And, you know, that's something that is an individual choice. And, you know, for nurses, it's a hard decision because a nurse is who you are, and it's not a job that you do. And so this has really caused pause in many different, you know, areas of nursing, and it's something we have seen and continue to keep our eye on because it is very concerning. So we talk about bringing nurses in and recruiting. Retention is more important than ever. What we need to do to work with our nurses, listen to them, and pivot and change. All ideas are open to figure out how we can keep them at the bedside, safe and healthy.
I know that you all have been gathering this feedback from your nurses during the last more than a year and a half during the pandemic. So based on what you know so far, what can we give our nurses to help them in this very dire situation?
There's a couple of things. I wish I had a magic wand that I could wave and say, here's, you know, 80 more nurses. You know, we were talking about cloning, but we're just not there yet. They need work-life balance. They need support more than they did last year because we're in the second wave of this. Many of them have concerns at home. Children are going back to school, and their work-life balance is stressed. And that is our #1 priority now, is to continue to see how we can support them, not just in the workplace, but also at home. You know, we would love to see all our community to know, please get vaccinated. There's stories, there's questions. You know, reach out to a trusted provider that can help answer those questions. And also, when our visitors and families are coming into our facility, please be kind to our caregivers. You know, they want to take the best care of our communities. It's what they do, it's in their heart, that's why they became nurses. And if we need masking and we have to limit visitation, it's because our goal is to keep everyone safe.
And I think this frustration for nurses this time around is, at the beginning of the pandemic, we didn't have the vaccine. And now that we have it, we have this great tool, but yet we're still seeing this surge in the ICU. It's totally preventable.
Absolutely.
Yeah, all right. We've been hearing from Susan Robel, Chief Nursing Officer for Intermountain Healthcare. Susan, thank you again for what you do, and thank you for being here tonight.
It's my pleasure. Thank you so much.
We'll be right back. Welcome to our third and final In Focus discussion tonight, our August COVID-19 update. Now we turn to a discussion on the importance of vaccinations and what other preventative health measures you can take. Rounding out our conversation tonight are Claudia Cerrone and Ayan Noor, community health workers for the Salt Lake County Health Department. Well, ladies, you look beautiful in black tonight. Thank you for joining us, and thank you for what you do in our community.
Oh, thank you.
Claudia, I'd like to start with you. The Delta variant is now the dominant mutation of the virus in the U.S. What do we know about it so far?
Yeah, so what we know is that compared to the other viruses, what we like to say at work is the OG COVID that we saw last year, the Delta variant is a lot more contagious. It spreads faster within the community. The rates of hospitalization, rates of infection, rates of death are a lot higher than that of the COVID that we were seeing last year. And what we know is that vaccinations offer protection against that Delta variant, which is why it's very important that we get vaccinated.
Right. This virus is just getting smarter. It's just changing basically its game plan. Claudia said that vaccines are the best protection against the virus. Why is that? What is it about vaccines? And we want to talk about this question mainly to curb the hesitancy that comes with vaccines. Let's get into the why. Why are they the best protection against the virus and its variants?
Yeah, so it is very effective. For those who are fully vaccinated, if they did get COVID, it was way more mild and shorter illnesses happened. So for those who are unvaccinated, you see hospitalizations, you see deaths, and pretty severe illnesses. So the vaccine is important for that reason.
Claudia, help us clear up this misconception. People think that the vaccine will prevent the virus 100%. And like Ayan said, like it just, you know, if you do get the virus, it makes the symptoms a little bit more mild. So for those who are alarmed by these breakthrough cases, oh, there's people getting vaccinated, but they're still getting the virus, what would you say to them to help clear up that misconception?
Right, so no vaccine is 100% effective against anything. What we're really wanting to, the message that we really want to get out is that when you get vaccinated, you have that 92-95% efficacy rate with Moderna and Pfizer, so there's definitely protection against the virus. But, sorry, I forgot what I was going to say. You have that protection, so the vaccine is going to help you so that, like Ayan said, you don't get as sick if you were to get it. And people think that with the side effects that they get, that they have COVID, but that's not the case at all. So we just really recommend that people get vaccinated because they're not going to get as ill if they were to get COVID. So it's definitely providing that protection against it.
So this is what I think of. The vaccine is like a seatbelt. You can wear a seatbelt, but you can still get killed in a car accident. It's like birth control. It prevents pregnancies, but you could still get pregnant on that 1% of birth control. So the vaccine kind of reminds me of that from like, based on what you're saying. It's not surefire, but it does decrease your chances of dying or going to the hospital with it. Ayan, for people who are already vaccinated, is there any other precautions they can take to even up that level of protection against the virus?
Absolutely. So I like to say prevention is better than cure. So we continue to promote, you know, the mask. Wear your masks, wash your hands, distance from, you know, others. Try not to be in very large groups, but most importantly, it's the masks in public settings, especially with schools back in session now, and people are becoming, what's the word? There are more people going back to their offices and not working remotely, so the masks would be the most important message out of this.
Right, add the mask as well. That's another layer of protection that you can take if you're already vaccinated. I want to talk about the immunocompromised, Claudia. You know, maybe you're not vaccinated, you don't trust the vaccine, you have hesitancy for whatever reason, but maybe there's someone you love who's immunocompromised. What's the best way to protect them, or what would you say to those individuals?
Well, the best protection is to get vaccinated. We're not just getting vaccinated to protect ourselves, but if they have family members that are immunocompromised, then it's definitely more important because we did see that people that were immunocompromised were most susceptible to the virus, and they were having really severe illnesses. So definitely recommend getting vaccinated so that you don't put them at risk, because that would be terrible.
Think about the ones you love.
Right.
Right? If you're not doing it for yourself, do it for mom, for grandpa, for your uncle, for your brother, for your sister. Ayan, we have a minute left. Final thoughts. What message do you want to send to our viewers tonight, or what would you like to leave them with?
Yeah, so again, prevention is always better than cure. I know there are many people who are scared of like the symptoms from the vaccine, but that's nothing compared to symptoms that you get and long-term effects from the actual virus. So please go get vaccinated. Your life depends on it, really. So.
And one last thing I want to talk about is those who have only gotten their first dose. They need to go get that second dose, right? You can't just be half vaccinated. Get your second one if you haven't already.
Exactly.
All right, you've been hearing from Claudia Cerrone and Ayan Noor, community health workers for the Salt Lake County Health Department. Ladies, thank you so much for spending your Friday evening with us and sharing this very important message.
Thanks for having us.
Also, before we leave you, we want to let you know that ABC4 will be hosting a free neighborhood COVID vaccine drive-through clinic at our station on Saturday, August 21st from 2:30 to 5:30 p.m. This is in cooperation with Salt Lake County Health, and there will be prizes for the first group of people who show up. We'll be right back.